Greetings. My name is Lance Bell. I actually had a show lined up today that was all about Hillary Clinton, but I scrapped it completely for a very important reason, and it does not have to do with the police officer shootings in Dallas on Thursday. Living in Akron, there is something very bad that is happening right now. Since the July 4th holiday, there have been 25 overdoses and 4 deaths due to heroin. The reason why I'm even talking about this is because this was never an issue in this city. Sure, we had crack back in the 1980s, but what major American city did not have that back then? Now, as of this taping, there has been no more reported, but this is not good. My first question was very simple. How did it get so big here? The answer lies with some of the small-time dealers that I know and what they were telling me. It is cheap right now in the area, and doing some research, I know why. I had to go back 20 years ago when meth showed up in town. It did not get big here about 10 years ago, excuse me, but my understanding is that the price of that drug is being undercut due to the fact there is not as many cooks at the moment, and the glut of supply coming from south of the border, which I will discuss later in the commentary. Now, according to the Akron Beacon Journal, there has been 58 overdoses that resulted in death this year alone. That is mind-boggling in a city with a population of 197,000. I knew a person that died of overdose this year. Now, I tried hard to find videos for you, but my server has not been updated, and there has been no response to the correspondence to other media outlets to use videos. So I had to go back and watch a speech by Ohio Senator Rob Portman from last year speaking at the Congressional Addiction Forum, and here's what he said.
I'm just delighted that we've had the opportunity to talk about youth and focus on prevention, as well as I just heard, recovery and treatment. And this is the 4th forum that we've had, and every time we meet, we learn something new. This particular discussion today, as I understand, is going to be broadcast repeatedly around the country at some of the at the coalition meetings, as more and more of our coalitions are getting into the issues, not just of education and prevention, but also treatment and recovery. And I'm delighted about that as well. I also think this gives us some momentum with regard to CARA, and I thank you for your support of that legislation, which is the comprehensive approach looking at, again, education and prevention and right through treatment and recovery. We have a separate bill that is about to be introduced that I know many of you are very interested in, and that is the reauthorization of the Drug-Free Communities Act. And as was noted, I was the author of that back in the House days, and at the time we thought, this is probably worth trying because it's so important to focus on keeping people out of the funnel of addiction. And it's the most cost-effective way. It's incredibly important to try to focus on what works in this area, and coalitions seem to be working. We had no idea how successful it would be, to be honest with you, because I think it's true now, and General Dean or Sue Thaw, who's here somewhere, can correct me, but I think we've now supported 2,000 community coalitions around the country. Over 9,000 volunteers have been engaged through that. And so, it has worked, and we have to be sure as we reauthorize this program that we improve it, streamline it, so your input is very important. My understanding is that Senator Grassley, Senator Leahy, Senator Feinstein are all interested in this reauthorization, which is really important because that's Judiciary Committee will be the key committee. And so I'm looking forward to continuing to work with them and with you to put together the best reauthorization possible. And we hope to introduce it very shortly. So I thank you in advance for what you will do, both to be sure we have the input, but also to encourage that legislation moving forward. There is always more to do, and right now in my own state of Ohio, we have an increase in not just opiate use, but specifically heroin use. And this morning I was with nurses who are working in emergency rooms in Ohio, and they came to talk to me about their policy issues, but what they really wanted to talk about was the number of people who are showing up in the emergency rooms. And these are people who are addicted, people who have lost hope, many return patients. In other words, they're seeing people again and again. And their question to me was, what are you all doing to help with regard to this issue of increasing drug addiction in our my home state of Ohio? And it reminded me of 20, I'm going to date myself here, 21 years ago, or yeah, 21 years ago, being in the House of Representatives and having a constituent come to me and said the same thing that these women said to me this morning. And in her case, it was about her son who had just died of an overdose of huffing gasoline and smoking marijuana. And she said, "What are you doing?" And I said, being fully briefed by my wonderful staff, I said, well, we have the answer. We're spending $15 billion a year on prosecutions, on intervention, on eradication of drugs in countries like Colombia, you know, supply side, supply side, supply side, and law enforcement. And she kind of looked at me and said, well, how's that going to help me in my community? You know, our church is in denial. It says it's not a problem here. They won't get involved. I called a meeting of parents. No one showed up. The school doesn't want to get engaged because they don't want it to be on their report card. And that's how, you know, we really launched this community coalition effort, is to say, how can you help this mom who has just lost a son? She had another son. The son she lost, Jeffrey Gardner, I still have his gold ID bracelet that I keep, but her other son is doing great. But she was, of course, very worried about him following in his older brother's footsteps. So it's a difficult task because prevention and education is something that, frankly, we don't have the best science on, although it's much better now, and the evidence-based work that this group has done and others is very important, and that's one of our, as you know, prime focus of the Drug-Free Communities Act is to ensure we are using evidence. And in Cincinnati, every 2 years, I chaired our coalition there. I founded it and chaired it for 9 years, but every 2 years we do almost, it's a survey, and it's hundreds, tens of thousands of students. So it's not just sort of a poll, it's a real survey, and we try to use that evidence to come up with better strategies, but there's more work to be done there, isn't there? And it's a challenge. And then on prevention and education, it's always a challenge to find the funding. And that's why, again, Drug-Free Communities Act is so important, because it's matching funding. On prevention and treatment, I know there was discussion about some of our colleges and universities. At The Ohio State University, we have, as of, I think about a year and a half ago now, a group of recovering addicts who have come together and formed a support group. And first time ever at the largest university campus in America. I'm sorry it took so long, but I'm so grateful for the courageous individuals who started that group, and we need to support them. But recovery is obviously full of challenges too, and we need better information. We need, you know, better medication, frankly. We need to understand better what works and what doesn't work. So this group, again, is very important in that regard. We can never, ever give up. And, you know, there's lots of reasons for that. It has to do with our economy. It has to do with jobs. I went to a factory in Ohio recently where half the people who applied for a job couldn't pass a drug test. But it's really about the devastation to families and communities. And it's really about letting people achieve their God-given abilities and giving them the support to be able to do that. And so the Jeff Gardners of the future have a chance to pursue their dreams, and that's what you're doing. So it's a noble undertaking. It's not easy, and there are plenty of challenges along the way, but we need your advice and counsel, and we need to get care of moving. I'm not sure we'll be able to move the entire package, but I'm for doing whatever we can. And my sense is the Judiciary Committee is now looking carefully at that, in part because of these fora and our ability to explain the issues as you go around to offices. I know some of you are involved with that effort right now. And then with the Drug-Free Communities Act, I think there's a chance for us to improve it, to reauthorize it, so that every year in the appropriations process I don't get this question, well, you don't have an authorization. How much should we appropriate? Is it really working? These authorizations are key, particularly in a time of increasing pressures on the discretionary budget. So thank you so much for what you have done and will do. And for those who wonder, are you making a difference? Absolutely. Absolutely. And when I'm home and I meet people who are in recovery, or I meet people who are young people willing to stand up, in high school with peers who sometimes apply pressure to them and say, this does make a difference. I'm willing to stand up. That is what ultimately is going to solve this problem. Not Washington, D.C., but Washington, D.C. helping at the local level.
Portman was on WAKR Wednesday, and he spoke about the vote Friday regarding the Comprehensive Addiction and Recovery Act, which should be on the President's desk later next week, and it is much needed, and from what I have researched, has bipartisan votes to happen. Excuse me. I know that this is an older video, but this has been around for a while, and he wants to do something about it. In doing the research for this week's show, I came across this video from New Jersey television, and in this report, this is what they are doing in Ocean County.
We're expecting a full room here at the Conference Center on Route 37 at the Clarion Conference Center in Toms River. This is NJTV's New Jersey's Drug Addiction Crisis Community Forum, the first of 4 forums we'll be holding throughout the year. We'll have a panel of experts here who will be talking about this issue from a personal and a professional point of view. We'll also consult some folks here who are with the Mental Health Association and other organizations to talk about this issue. Not just a New Jersey problem. Early today, President Obama was talking about this, talking about tripling funding for treatment, trying to get Congress to do that, and 60 institutions, universities are talking about training their medical students on different ways to treat pain in this country and better ways to do pain management, perhaps not as many opioids as we've been using the last few years, which seems to have gotten the entire society in trouble. Back here in New Jersey, perhaps the heroin addiction problem may not be more acute than it is in any other place, and so are the solutions much more innovative, perhaps, than any other place right now. This is a forum that's going to explore all kinds of issues about this, to enlighten and to educate. This is not about, as the organizers say, this is not about demonizing anyone who's on any of these prescription drugs, who is under a doctor's care, and legitimately so, but this is about folks who have lost control of their addictions and folks who've lost control of those legitimate prescriptions for opiates in this country and in this state to deal with those kinds of issues. One of the panelists we're going to have here this evening is going to be Rory Wells. He's an assistant prosecutor with the Ocean County Prosecutor's Office. Rory, come on in. Thank you for joining us. You spend a lot of time, you're welcome. You spend a lot of time talking to community organizations and kids in this area. How bad is the situation here in Ocean County?
Thank you. I do. I get out in the community quite a bit, and I speak with folks of all ages. And I would put it at this point. I don't feel certainly we've licked the problem yet. I think it's still at its epic high. I do feel that we'll turn it around at some point with the attention and the resources that need to be applied to this problem as we continue to do so. But right now it is still at, unfortunately, devastatingly high numbers in terms of overdose deaths and non-fatal overdose as well.
And you say that based on the numbers?
That's correct. That's correct. And just watching the number of overdose deaths as they've gone year by year, they've continued to increase. And even when they've decreased, we've noticed that with a lot of applications of the naloxone reversals, if we did not have that, then the numbers would be through the roof. So we're very thankful that we're able to reverse a lot of these overdose deaths. But it still signifies that the problem is at a very great height.
When you talk to kids in the community and in schools, you told me about 5, almost 6,000 kids so far. Do they get it? Is your sense that they understand what you're talking about and they understand the severity of this?
Yeah, there's a lot of good kids who, just like anyone else, at some point in their life, they're going to be tempted and they're going to be faced with the question of whether they experiment with drugs. And when someone like me comes in and speaks to the school, I'm trying to reinforce values that the teachers are already trying to put in place, that the parents may already be trying to put in place, so that way they're equipped to make wise decisions. I do think the younger generation, as we continue to get through to these younger kids, I do think the problem will subside, but that's going to take time.
Time and a lot of effort, a lot of energy, and a lot of resources.
Correct. It's not just, you may have heard it before, it's not just one side, it's not law enforcement, it's everyone. It's the health department, it's law enforcement, it's doctors, pharmacies, faith-based, institutions. Everybody has to come together really to throw the resources at this kind of problem, and that's, I think, what it will take in order to turn the tide.
Understand something. This is not a local issue. This is nationwide. Also, in this next video, there is something even stronger than heroin, and that is fentanyl, and that is explained in this video.
Stronger than heroin, more powerful than morphine.
It's a death sentence. It's not if, it's when.
Fentanyl, a synthetic opiate used to treat cancer patients. So dangerous you have to be careful just touching it.
All a person needs to do is take, snort, swallow just a few grains of fentanyl, although he or she believes they're taking heroin, and it could be deadly.
Fentanyl deaths have spiked in New Jersey. Overdoses increased nearly 300% between 2013 and 2014, according to the most recent data available from the State Medical Examiner's Office.
Since January of 2015, January through September of 2015, we've had an increase of 651% of fentanyl-related cases that have been submitted to labs in New Jersey. So the use has really increased.
In one instance, I guess about 6 months ago, we found in the packaging there was no heroin whatsoever, that was just all fentanyl. And obviously we had a huge problem with that, because then we had a tremendous amount of overdoses and unfortunately a lot of deaths that took place as a result of that.
The Ocean County Prosecutor's Office says it alerts the public when it finds fentanyl-laced heroin on the streets. The drug is odorless, colorless. People could be purchasing it without knowing it. But they said that's a double-edged sword. For addicts seeking a higher high, knowing it's out there could be a death sentence.
The problem really is that your body's not acclimated to that type of strong opiate that's in there. Again, it's 100 times more powerful than even heroin. So what happens is your body overdoses as a result, cannot tolerate that, and shuts down.
The DEA says New Jersey might have the highest purity of heroin in the U.S. at 58%, all because of location. A stone's throw from 3 international airports and the largest port on the East Coast, the 3rd largest in the country. All surrounded by a network of interstate highways, the drug gets cut as it moves west. While pharmaceutical fentanyl is used in hospitals, street drugs come in from Mexico and China, or are grown in labs across the country. 1 gram of the pure stuff can be cut into 7,000 doses for sale.
They're the predators that we're going to be going out to look for. They're the ones, because that is the death sentence that they're selling.
Prosecutor Coronado says homicide and drug units have been able to track back and locate where a person who overdosed bought the drugs. And strict liability gives the prosecution leverage. The dealer is charged with distribution and homicide.
Now, supposedly there is something out there to help that is Narcanone, also called Narcan, that is a life-saving drug. In this next clip, Pennsylvania Governor Tom Wolf discusses what has been done for his state.
There are a couple of things I want to just point out today. The first is that I want to announce that all of us have been successful in saving over 1,000 lives with naloxone in just a little over a year since we let's just remind ourselves how we got here. Last year, Dr. Levine issued a standing order. Actually, she did 2 things. First of all, she made it available to law enforcement officials. And up until last year, I think there was only one county, it was Delaware County, that had access to naloxone. But after Dr. Levine did what she did, every law enforcement officer and firefighter had access to it in Pennsylvania. The second thing she did was issue a standing order, basically a prescription for almost 13 million Pennsylvanians, to make it available to all of us, so that we can go to a pharmacy and we can actually take advantage of the prescription we all have. If we know someone using the Good Samaritan legislation that passed the House and the Senate a few years ago, was it a few years ago? Am I right in that? That we can use that to give this drug to a loved one who is suffering. Since that time, I'm going to get this right, state and local police, firefighters, sheriffs, first responders, school officials, and citizens at large have begun to carry this highly effective tool in the fight against opioid and heroin abuse. So that's what we've done, and it has led to the 1,000 life savings that we've had so far. Now, this is incredibly important. I've gone around to have roundtables, and we've got to recognize that this is absolutely necessary to address the scourge of opioid abuse in Pennsylvania. But it's not sufficient. It's a first step. I mean, one of the things is you bring someone back, that person needs to have follow-on treatment. And just simply bringing someone back is not enough. On the other hand, if we don't bring someone back from death, then we'll never get the chance to provide the treatment that person needs, that victim needs. So this is really important. It's a very important first step, and we have to make sure that we keep doing what we're doing in this regard. Fourth thing is my administration is committed to doing whatever we can to continue to confront the challenge. Now, I put $34 million into my budget, which was going to be matched, I hope, with $18 million from the federal government, which would mean over $50 million for 50 treatment centers, centers for excellence around the state that would allow for the post-treatment, ongoing treatment and reintegration into the society and the economy of over 11,000 victims of substance use disorder. The idea is that these are not detox treatment centers. These are not treatment centers where someone lives for 30, 60, 90 days, but after that treatment, this is the handoff to get that person back into society. And so it has, again, it's a start. It's just part of what we need, but I think the reason there's such bipartisan support for this is that we all recognize that we cannot arrest our way to a cure. That we have a criminal justice problem here, that there are people who are preying on the victims of substance use disorder, and we've got to treat them as the criminals they are. But there are too many people in our prisons who are suffering from a medical problem. And we could treat them more effectively and save more lives and do it all with a lot less money if we treated this as the disease that it really is. So there's real good bipartisan support for this. We all want to do the right thing because it's right, but also because it's actually very smart. So this is a really important thing that we're trying to do with the $34 million. And if I've heard criticism of it, I've heard some criticism that we want to make sure that we're doing this the right way. But by and large, if there's any criticism, are we sure that this is enough in the first pass? So I think this is something that really does enjoy bipartisan support. We've also had, at this point, have 450 drug take-back boxes, drop boxes. And the idea there is that you end up with a prescription for oxycodone, and you have more pills than you need. What are you going to do with it? You can't flush it down the toilet. You don't want to leave it in the medicine cabinet because that could be a place that somebody finds them and steals them. So put them in a drug drop box. We now have 450 of those. The goal is to have at least one in every county. We have at least one in 60 counties. So we still have 7 counties without a drop box, but we're working on that.
Now look, folks, from what people are telling me, this life-saving drug is a crapshoot. Fentanyl is potent and sometimes it does not work. And this comes back to my comment from earlier in the show. Now I know that it's also coming from Europe, but living in Phoenix for years, my friends were telling me something even more sinister. Heroin is being cut, sometimes with gasoline, and with horrific results, and it is coming straight from Mexico. Now, I'm not going to show the videos or images, but to put it graphically, it is flesh eating, and I am not joking about that. Just look it up. It is there. Now, I am thankful that it is not shown up here in Akron yet. However, here in the Rubber City, we are trying to do something about it. Summit County has Project Dawn, and it could be a way out. My understanding that they are giving it away, so that is a start. Now, you're probably wondering, what about here in Akron? Well, here are my thoughts on that subject. I am not sure if the city knows what to do. I'm being serious about that statement, excuse me. We never seen this before. Yes, I know heroin's an old line drug, but it is so cheap right now due to the massive supply. Can we, as a city at large, keep up? This is a question that must be asked, and I even caught myself calling my hometown Smackdown USA yesterday. Unfortunately, the national media picked up on what has been happening here this week, and there are most likely people thinking the same thing right now. As a resident, I know that this city has issues that is for another commentary. However, I just want this to stop, and with all the deaths due to overdoses, and worry about everything else here in this town.